You already know smoking is bad for you, but what can you do to quit? There are lots of messages, but how do you know what will work for you? Smoking is an addiction and quitting is hard, but it is possible. It takes more than willpower, it takes skill power, and a nurse can help.
Well, nurses come into contact with the public in a variety of settings. For example, they are in hospitals, they're in clinics, they're in schools, and of course they're in patients' homes. This means that the public have come to really trust and depend on nurses for their sound healthcare knowledge. This knowledge and their skills become an important part of a smoker's quit journey. The Registered Nurses Association of Ontario is arming nurses across the country with best practices related to smoking cessation. This means that nurses will be able to work with patients and the public to help them quit smoking.
Hi John, I'm Jennifer. I'm a nurse here at the clinic. I wonder if you mind if I might ask you a few questions about your health today.
Not at all.
Okay, great. I think we'll start with tobacco use. So have you used any tobacco products in the last 6 months?
Well, I smoke about a pack a day.
And have you ever tried to quit in the past?
I've tried to quit before, 3 or 4 times, and I've always failed. And sometimes it's because I've gone to parties and I've tried to not smoke at parties, and someone offers me a cigarette, and the temptation is always too much.
Congratulations on those quit attempts that you've made in the past. You can certainly learn a lot from those quit attempts that will help you when you move forward to a long-term quit attempt and eventually becoming smoke-free long-term. And are you thinking about quitting again in the next few months?
Definitely I'm interested because I want to quit for my family's sake and I want to quit for my own health.
Well, what I can tell you is quitting smoking is the most important thing that you can do for your health. There are lots of resources and tools available to you. You can access nicotine replacement therapy, other medications. You can certainly speak to your nurse, and you can access self-help materials.
One of the first things a nurse will tell you when it comes to quitting smoking is that it takes practice. And most smokers attempt to quit several times before they successfully stop smoking or using tobacco for good. Nurses do know the right questions to ask, they provide advice, they offer assistance, and they arrange for support to keep you on track as you move through your journey of quitting smoking.
Take charge of your health. To help you quit smoking and stay away from the dangers of tobacco, speak to a nurse today.